everyone, welcome to ResearchMD.com. My name is Pramil Cheriyath. I'm a Program Director, Internal Medicine Residency, Transitional Residency, Director of Research and Assistant Professor of Medicine, 2 large medical schools in the United States. And we've been doing a series of lectures on endocrinology. Today, we're going to talk the most important hormone in endocrinology, which is the thyroid hormone. We're going to teach you everything about thyroid hormone in 10 minutes, okay? So let's start with when we talk about thyroid hormone, we have to go back to hypothalamus, anterior pituitary, and the thyroid axis. That's what we have to visit. So you got thyrotropin releasing hormone that is going into the anterior pituitary. It stimulates the TSH, and the TSH act on the thyroid hormone, and then you got T4 and T3 production, and this can go back and that can inhibit the T4, T3, and some other thing, dopamine and somatostatin and steroids can also inhibit this. Okay, remember that. Now let's go into a little bit more deeper and to find out the formation of thyroid hormones and all that. We already talked about the thyrotropin releasing hormone is produced in the hypothalamus. So what does it do? Once it produces, it has to come to the anterior pituitary, right? So they need to have like a receptor. What is the receptor? It's a GQ/11 receptor on the anterior pituitary. Then series of cascade of events happens. Phospholipase C activation is there. And then hydrolysis of phosphatidyl inositol and biphosphate, okay? And that leads to inositol triphosphate and diacylglycerol formation. That can lead to most important stages, the calcium efflux, exocytosis, and the TSH is released into the circulation. Very, very important to know that, okay? Once the TSH is released, where does it have to go to? It has to reach the thyroid. You go through the blood and reach the thyroid. And then series of cascade of events going to happen over there too. Let's find out. The main thing is like they have to find a receptor. There's a TSH receptor, which is a G protein coupled receptor. Once it binds to the receptor, another cascade of events happens. There is CAMP activation, phospholipase C activation, and protein kinase activation take place, okay? That triggers like a lot of activities in the follicular cell of the thyroid. What are they? 1, iodide uptake, sodium ion importer activity, transcription of thyroglobulin, thyroid peroxidase, iodide efflux, hydrogen peroxide production, thyroglobulin iodination. All of this because when it combined to the TSH receptor with the thyroid, TSH combined with the thyroid receptor, okay? Now let's switch the focus, go back to the thyroid follicular cell and what happens. So what happened? Let's go to look at the basolateral membrane, and this is the follicular cell, okay? They got this 3-sodium 2-potassium ATPase pump, which create like low sodium gradient over here. When you create the low sodium gradient, that activate 2-sodium iodide importer. What does this do? Sodium comes in with the sodium, iodine also comes in. Okay, this is happening in the basolateral membrane, and this is happening in the follicular cell. Remember that. Okay, now we know this iodine is coming in, and iodine is over here. They kind of go through this iodide channel over here, and then series of events happen. 3 things I want you to remember. 1 is oxidation, organification, and coupling to get our T3 and T4. Okay, so the iodine comes up here. There is in the colloid of the follicle, there's thyroglobulin and tyrosine residues are already in there. So iodine go there and combine with it. First series of steps is like oxidation and the organification happen. And then look at iodine. It's attached to the 3-carbon atom right here. Okay, and that with the help of thyroid peroxidase form monoiodotyrosine. And you got diiodotyrosine. So what is monoiodotyrosine? What happens is like it's only combined at the 3-carbon, only like one site. Okay, here it combined the 3rd carbon and the 5th carbon. So it's called a diiodotyrosine. Remember that, okay? So, and then what is the next big step is the coupling. Even thyroid peroxide also helps in the coupling. So what happens in the coupling? You got T3 and T4 formation. Okay, in the coupling, first you have monoiodotyrosine and then diiodotyrosine form 3,5,3 triiodothyronine, which is T3. Okay, remember that. So you got monoiodotyrosine, diiodotyrosine, and that forms the T3 right here. Okay, now let's look at the other coupling reaction. You got 2-diiodotyrosine. 3 and 5 carbon atom, iodine is attached, right? So diiodotyrosine here, diiodotyrosine over here, and then he got T4. So once we have T3 and T4 formed in the colloid, it moves into the cell. Okay, into the cell, you got thyroglobulin, T3 and T4, you got monoiodotyrosine and diiodotyrosine. But majority is like T3 and T4, okay? And then lysosomal proteases cleave them, and then release of T4 and T3, they come into the peripheral tissue, and then another series of steps happen. Couple of more, another steps. This lysosomal protease, we got monoiodotyrosine and diiodotyrosine. With the help of iodotyrosine deadenates, it cleaves the iodine back into the circulation. Okay, so you got like a recycling kind of going on of that. Now, what happens to the release of the T4 and T3? That going to into the peripheral tissue. So you got T4 is converted into T3. Let's look at how T4 is converted into T3. Okay. Now, this is usually can happen in the liver, kidney, those are the main organism, and the thyroid. The three places you can have that. First, you got this deiodinase 1 and 2. They work on the T4's outer ring, okay, and then combine and then make that into a T3 first. And then remember, T3 is the most active biological form, right? And the next step is you have the inner ring. So the deiodinase 1 and 3 work on the inner ring. Deiodination of the inner ring, that forms something called a reverse T3, which is not biologically active. There's only very few amount that formed. Now, another steps can also happen. Deiodinase 1 and 2 can convert this T3 into T2, and this reverse T3 also can be converted into T2. Okay, and this is happening in the peripheral tissues. Now, let's look at some of the pathophysiology. Where could go wrong? One, TSH receptor. There's some antibodies can form against it, right? Number two, you can this perchlorate and pertechnate, this like some of this environmental toxin, then can inhibit this iodine channel and can affect it. And then radioactive iodine can inhibit it. High dose potassium iodide can also affect this iodine channel and can decrease the iodine transport. Okay, now. In the T4 and T3 conversion, the peripheral tissues can be blocked by propylthiouracil, beta blockers, steroids, and amiodarone. Very, very important, the role of amiodarone. Okay, very important to know. So let's look back and summarize what's going on over here. So we got the thyroid hormone. The first thing we need to know is find out the thyrotropin releasing hormone in the hypothalamus. Okay, what does it do? They travel to the anterior pituitary combined with this GQ/11 receptors. Okay, and then phospholipase C activation, hydrolysis of phosphatidyl ionosyl biphosphate, and that's converted into ionosyl triphosphate diacylglycerol. That causes like a lot of calcium to release. And what is the calcium? Exocytosis, and then the TSH is released from the anterior pituitary. Now, where does this TSH has to go to? They have to go to the thyroid, right? They have to find the receptor, TSH receptor in thyroid. Boom, then a lot of cascade of, reactions are over up here. You got the G protein coupled receptor, you got activation of CAMP, phospholipase C, and protein kinase C. And that kind of act on this thyroid, and then series of events happen like all over the place. Okay, that is the beginning. The TSH combined with this receptor on the thyroid. Now let's look at the basolateral membrane and what happens over up here. There's a couple of pumps over there we need to know. First one is the 3 sodium and 2 potassium ATPase pump that create this low sodium gradient over here in the follicular cell. What did that do? That activates another important pump, which is sodium iodide symporter. That bring in sodium. When it comes with the sodium, it also bring in iodide. Okay, so iodine comes in and then go through this basolateral membrane, and then there is iodide channel. Okay, and then come up here, and then three steps can happen. One is oxidation, one is organification, other one is coupling. When you talk about in the thyroglobulin, what is it sitting there? So already thyroglobulin is there with the tyrosine residues. So the iodine combined with them, first oxidation organification, iodine combined at the 3-carbon level, it can combine at the 3-carbon level and the 5-carbon level. If it is combined on the 3-carbon level, it becomes monoiodotyrosine. If it is combined at 2, 3rd and the 5th carbon, we call it diiodotyrosine. Okay? Now, what happened? Next important step is coupling to form the T3 and T4. So what happened to formation T3? You got monoiodotyrosine right here, and you got diiodotyrosine. Combined coupling reaction, you can form T3. Now, you got over here, you got 2 diiodotyrosine, right? 1 diiodotyrosine and another diiodotyrosine combined, they form the T4. Okay? Once the T4 is formed and T3 is formed, that moves into the cell from the colloid. And then series of steps up over here, lysosomal proteases cleave them, and some of this iodine is come back and recycling over here. Then you have release of T4 and T3. What does it go into peripheral tissues? This T4 is converted into the biological form of T3. This is where all the biological conformation that can happen in the liver, it can happen in the kidney, and the thyroid also. Okay, 2 enzymes we need to know, which is deiodinase 1 and 2. That first work on the outer ring, right? When you look at the outer ring, it converted into T3, which is the biological form. They work on the inner ring to produce reverse 3, which is not biologically active, but very few amount is produced. And always remember, deiodinase 1 and 2, and they work on the T3 and T2 to form T2 also. Okay, so in a nutshell, that's all about thyroid hormone. Very, very important to know. Please go back and kind of just look at it again, where all the actions are taking place. Okay, it's very important to review again and again, because it can produce, the most important hormone in the body we have to know. Thank you so much for watching. We'll be back with another presentation soon. Please subscribe to our channel. Thank you very much. Bye.